Medicare is not free. Let's take a look at the different costs and what you could do about it. We still don't have the cost for 2025, so I'm going to do this explanation based on the cost in 2024, and then I will redo this exact video with updated numbers. So when I say Medicare is not free, there's two things I want you to think about. There is the monthly premiums, and then there are cost sharing, ways that you contribute towards your care, a bill just like you do in your insurance now. Our focus here is the cost if you choose to stay in original Medicare. You stay with the federal government as your insurer. So let's look. So I have in this chart behind me Medicare Part A, your hospital coverage. It's inpatient, that could be skilled nursing facility care. And then Medicare Part B, which is your doctors and labs, everything outside of the hospital. Although emergency room is considered billed under Part B. So if you look at this, you break it down, you have costs, monthly costs, premiums, and then you also have that cost sharing just like you do in your insurance now. So pre-65, you may go get some sort of a service and the insurance pays part and you may have to contribute to some of that cost. Now, when we go through this, you're gonna see that most of these costs that I talk about, you can cover with a Medicare supplement policy. So what I'm doing here is I want you to understand the cost. It's going to give you an understanding of why that supplement can be so important for you. So when you look at Medicare Part A, Medicare Part A for most people is a $0 monthly premium. If you've worked 10 years or you have 40 credits, you're going to pay a $0 premium. For those of you who have worked less, 7.5 up to under 10 years, then you're going to pay $278 a month for Part A. And for those of you less than 7.5 years of work, Part A is going to cost you $505. Now, if you go to this side and we talk about Part B's premium, the standard premium in 2024 is $174.70. However, if you are a higher income earner, if you earn more, if you file your taxes single and you make more than $103,000, you're going to pay more than the standard amount. If you file your taxes joint and you make over $206,000, you also will pay more. And there's a whole chart that breaks it down into the categories depending on the threshold of your income to let you know what it is that you're going to owe for your Part B premium. For your premium for Part B, that is going to be yours to pay, whether you stick with Original Medicare, which is our focus right now, or you switch over to Medicare Advantage. No matter what, you got to be paying for your Part B. So now we know you have a monthly premium. The question is, what am I talking about when I say cost share? The cost share is typically deductibles, co-pays, or co-insurance. And when you look at Medicare Part A, if you were in the hospital inpatient, you would have a deductible of $1,632. Now, if you notice to the left of it, you can see a yellow check mark. That's because you can cover that with a Medicare supplement policy and not pay it. But I still think that you should understand it. So you have this $1,632 deductible, which means and then the first 60 days, if you're in the hospital up to 60 days, there's no additional cost to you or to your supplement policy. If you end up in the hospital longer than 60 days, then there is a copay of $408 a day for days 61 through 90, but you can see the yellow check. You can cover that with a supplement. And then if you are in the hospital past 90 days, that rare chance, it's $816 a day. You have 60 lifetime reserve days to cover that. And again, check mark next to it because you can cover that with a supplement. You notice to the left of me, I have co-insurance for the hospital and a co-insurance listed for skilled nursing facility care. So let's talk about skilled nursing facility care. Let's say you had an inpatient hospital stay. You have to have at least a 3-day stay to qualify for Medicare to cover the skilled nursing in a facility. Days 1 through 20, there's no gaps in coverage, but you can see right here, days 21 through 100, Medicare covers all but $240 a day, but you can get a supplement to cover that $240. So if you really think about what I've just told you with Medicare Part A, you can cover all of those dollar gaps with a Medicare supplement policy. but I still want you to understand it, like I said. And one thing to know is that the way that Medicare Part A works, it's with benefit periods. So when you go inpatient, that benefit period does not end until you've been out of care or skilled nursing for at least 60 days. If you go back in, then it's a new benefit period. But any time in that 60-day period after you've left the hospital, if you go back for care, you're still in the initial benefit period and you won't owe a new deductible. Part B, pretty simple to explain. There is a $240 deductible in 2024. If you notice, there's no yellow check mark next to it. There are no longer plans being offered to cover it. So if you got Medicare Supplement Plan G or N, it's not going to cover it. Some people are grandfathered into C or F where it is covered. But even when those plans were offered, I was often putting in people into G anyway. So you don't have to be worried. You can't cover that one deductible of $240. Once you've met that $240 deductible out of your pocket, the first $240 of Part B bills, then Medicare's on the hook for 80% and you have a coinsurance of 20%. That is the number one reason you want to get a Medicare supplement policy. You see the check mark next to it because that 20% is uncapped. So whether you have a bill for $1 million or you have a bill for $10, you're going to owe 20% and you can get supplements that cover that 20%. So what I want you to walk away with understanding from this video is that while Medicare was not designed to cover every dollar of a Medicare approved claim, you can get this Medicare supplement policy to help cover some of those dollar gaps that otherwise would come out of your pocket. The thing with the supplement is, yes, you pay an upfront monthly premium, whether you go to the doctor or you do not, but you have budgeted. You have an exact amount that you're spending and you know you're going to have excellent coverage by getting that plan to fill in the dollar gaps of original Medicare.